Hey guys, Caitlin here, and today I want to talk all about headaches. Headaches are a common chief complaint in the emergency department, and most of the time it is a benign process and is usually treated with compazine and Benadryl combination. But sometimes they can be a serious underlying etiology causing the headache. So today I want to talk about different types of headaches, the red flags for a headache, and possible imaging indications. The first thing you want to do for a headache patient is ask more about the characteristic of the pain. So when did it start? Where is the pain in the head? How long has it been lasting? How would you describe the pain? And so on. And then ask if they have a past medical history of any headaches or migraines. And with this information, you can really narrow down what type of headache they may be having if it is primary. And the three different types are tension, cluster, and migraine. If the patient is having a tension type headache, then the pain will most likely be in a band distribution as if the band were actually squeezing in on the patient's head. And this is usually worse with stress. If the patient is having a cluster headache, then the pain is usually right around the eye, wakes the patient up at night, and can be worse with alcohol use. If the patient is having a migraine, then they might have a unilateral pain, nausea, vomiting, photophobia, or hyperacusis. And sometimes migraine patients have an aura, which is a warning sensation before the migraine attacks. And sometimes this aura can consist of a scotoma, which is a defect in the visual field. Pictured here is one example of a scotoma that may precede a migraine headache. But there are many different types of scotomas with many different shapes and sizes. Seen here is a central scotoma. The next thing you need to address in any headache patient are possible dangerous red flags for causes of the headache. And a common mnemonic is called SNOOP, but I found this very difficult to memorize with the multiple S's and P's that are associated. So I made my own mnemonic called SINCAM. Like mentioned before, a common mnemonic to help you remember the red flags of a headache is seen here, and that is SNOOP. The S's stand for systemic symptoms like fever or weight loss, fever being any infectious process, weight loss can be seen in cancer, secondary risk factors like being immunocompromised or having cancer, neurologic symptoms of altered mental status or seizures, which can both be signs of increased intracranial pressure, an onset that is sudden or worsening, which can be seen in a thunderclap headache, also common in subarachnoid hemorrhages, older individuals greater than 50, papilledema, headache pain that is increased by posture changes or that is precipitated by a valsalva, or if the patient has a previous headache history but now their headache pain has changed or worsened in nature. Seen here is the mnemonic I like to use for the red flags of headache, and it's SINCAM. S standing for systemic signs and symptoms, fever, nausea, and vomiting. I standing for immunocompromised, so if the patient is an HIV patient or if they've been on chemo and radiation. The next I standing for an intracranial bleed. So suspect this when a patient may be on blood thinners, if they have a sudden onset of the headache, if the headache is the worst pain of their life, or if they have a history of a cerebral aneurysm, which is the most common cause of a subarachnoid hemorrhage. N standing for neurologic symptoms of seizure or altered mental status. G standing for giant cell arteritis. So if the patient has a temporal headache, jaw claudication, or any vision changes. C standing for cancer. So ask if the patient has any prior history of cancer that could have metastasized to the brain, or if this is a primary brain tumor, ask when the pain is worse. Brain tumors usually wake patients up at night or their pain is worse in the morning. A standing for an age greater than 50 years old, which puts you at risk for almost everything seen here. And M standing for meningitis. So ask about neck stiffness and fevers. And then you can always do the Brodzinski's and Koenig sign as well. If your patient comes in with any of these signs or symptoms, then I would recommend getting a non-contrast CT of the head, looking for that secondary cause of their headache. But if their headache is secondary to trauma, then you need to follow the New Orleans or the Canadian guidelines for CTing the head after trauma. The New Orleans and the Canadian guidelines are summarized here. If your patient has any of these after trauma to their head, then getting a non-contrast CT is definitely the next best step in your care. If you are like me and find this difficult to memorize, then you can always use the MD Calc app, which is available with iPhones and Androids, and it provides a good summary of all these signs and symptoms. And that's it, guys. Just remember, there are 3 primary types of headaches: the tension type headache, the cluster headache, and the migraine. And if it's a secondary headache, just remember the mnemonic of SNOOP or SING-CAM. And if the headache is secondary to trauma, try to involve the Canadian or New Orleans head CT indication rules.